They would also allow insurance to be sold across state lines, as does the Democrats' plan in the exchanges. But the difference is in the Democrat bills, there are minimum benefits that those plans have to offer. In the Republican plans, there's no minimum benefit requirements, nor would these plans have to comply with state benefit requirements. And so the current concern is that there are some states that have very few mandated benefits, that insurance companies would actually relocate and put their headquarters in the states with the lowest benefit requirements, and then those would be the plans that they would sell out across the country, so that, you know, possibly some of these plans would actually be plans that cover very little, so that people wouldn't necessarily be getting the coverage that they thought, and it would go back to that issue of uninsurance or underinsurance, where people thought they were covered but they really weren't. And these plans don't have any new regulations in them, like the whole thing about not denying for pre-existing conditions or not being able to drop people once they get sick. So all of that adds up to the fact that only about 3 million people are estimated to actually get coverage under any of these plans. So next steps for federal legislation. From the summit, the president decided to include 4 Republican ideas. He announced this yesterday. $50 million for state demonstration projects to reduce malpractice. He'd already put about $23 million in for that, but he's going to put in another 50. Improved Medicaid reimbursement to physicians. This is actually pretty important because Medicaid reimbursement, particularly for primary care, well, actually for all physicians, is really, really low. And it's quite difficult for people with Medicaid to find a doctor to take care of them. So the hope here is to raise Medicaid reimbursement to Medicare rates, in the hopes that this will actually improve access for people. The president has said that it's okay to sell or include health savings accounts in the exchange. These are actually pretty good for really high income people, but they're not so good for people that who can meet these high deductible plans that go with them. They're usually like $5,000 or $10,000 deductible plans, which if you're really wealthy, that may be fine. But if you make $30,000 a year, that's not going to work so well. And then he supports this idea of random undercover investigations to reduce fraud. Now, I got to tell you, the idea behind this is that you would take physicians and nurses and they would pose as patients and go see doctors. And if that doesn't undermine the doctor-patient relationship, the thought of looking at a patient every single time and wondering, is this really a patient? Or is this just, somebody, I don't know, but he was willing to put that in. So, next steps, here we are. This is the current strategy if we're going to move this thing forward. The House can pass the Senate bill tomorrow, and it can go to the president's desk, and he could sign it on Friday. So we could do that by Friday. The only reason that hasn't happened is the House has some really specific concerns about some of the elements in the Senate bill, which I talked to you about. This Cornhusker kickback, the affordability for low-income individuals. There needs to be this compromise that I mentioned on taxing the high-cost health insurance plans and closing the Medicare donut hole. Those are like deal breakers for the people in the House. So that brings us to this thing of budget reconciliation. The House, I think, will be willing to pass the Senate bill, assuming that the Senate agrees to pass a fix-it bill. And that would have to be done in the Senate under something called budget reconciliation, and I'll explain that in a minute. So this budget reconciliation bill will include things that are affecting the budget. They can only affect the budget. So things like the abortion language, for instance, cannot be in budget reconciliation. And it would fix these 4 things, all of which definitely affect the budget. And the House has to originate that bill because the House has to originate all bills that have to do with the budget. So the House would originate this bill and pass it, and then it would go to the Senate and hopefully be passed. Then the president signs the original Senate bill, and then he signs the budget reconciliation bill, which modifies the original bill. Got that? Doable. Several-step process, but doable. So this actually, I found this cartoon today. The president saying, you appear to have an obstruction, and we may have to do a bypass. So what that bypass is this thing called budget reconciliation, and it allows for no filibuster consideration of legislation affecting mandatory spending programs or taxes. So the difference here is, I remember I told you need 60 votes to block a filibuster. A budget reconciliation bill needs 51 votes to pass. So it's a simple majority rather than what's called supermajority that 60 vote threshold becomes. So what's been passed under budget reconciliation? Well, some really important things. COBRA rules were created under this in 1985. Welfare reform in 1996. The Children's Health Insurance Program was created using budget reconciliation in 1997. So was the Medicare Advantage program, which I talked to you about a few minutes ago. In 2001 and 2003, the Bush tax cuts were passed using budget reconciliation, both of which increased the budget deficit. So in 2007, Congress passed a rule that you can't use budget reconciliation to increase the deficit or the national debt because of those two tax cuts. So none of these things I talked to you about would increase the debt. In fact, the Congressional Budget Office has said that all of these bills will absolutely reduce the federal deficit over the first 10 years and even in the out years beyond that. But you can still filibuster amendments to the budget reconciliation bill, just not the bill itself. And so it's not clear if this is going to be able to get through the Senate or not. So we're just going to have to see. In the meantime, the president's done a bunch of things with his 2011 budget that he's put in to try to help this process along. One is money for federally qualified health centers, public health workforce and infrastructure, money for health information technology, comparative effectiveness research, school meals and childhood nutrition programs. You've, I'm sure, heard that Mrs. Obama has started a whole obesity program, which is great. Money for the National Health Service Corps and expansion of HIV/AIDS treatment, care, and prevention. And the House of Representatives actually did revoke the current antitrust exemption last week. So it's not clear if the Senate's going to vote on that or not, but the House has at least done it. And then we're already starting to see state-based things happen. So this is my canary in the coal mine. In Virginia, on February 1st, the democratically controlled Senate passed a bill that said it would be illegal in Virginia to require individuals to purchase health insurance. Now, whether or not this would trump a federal bill isn't entirely clear yet. It probably wouldn't. But states are already starting to tee up these bills that would try to undo whatever the federal legislation is. So I think I'm going to stop there in the interest of time. Physicians, though, I'm going to just make one more comment, have to some extent been all over the place, but for the most part have been together on this. And this was an ad that we actually helped put together, 14 organizations that represent a total of 500,000 doctors with their combined membership. And there are about somewhere between 700 to 800,000 practicing physicians in this country. No one's actually really sure exactly what that number is. But I'll just leave you with this thought. So I'd be happy to take some questions.